While malaria is a preventable and curable disease, half of the world's population is at risk of contracting malaria. In 2021, it is estimated that 247 million people contracted malaria, while 619,000 people died from malaria.
My name is Caroline Wambua. I am a laboratory scientist working at TreeLab Diagnostic Laboratory. We are located at Professor Nelson Awori on ground floor. The symptoms of malaria, the common symptoms are joint pains, fever, nausea, and vomiting. Then if the disease progresses without treatment, it can go as far as, the severity can go as far as developing kidney problems when it affects the other organs. Then we can also have convulsions as a result of infection to the brain, and we can also have breathing disorder or difficulty in breathing, which comes as a result of infection to the body organs, and it can actually lead to death, so it's considered very fatal. Most of the severe infections are found to be with the parasite, the strain by the name Plasmodium falciparum. It's one of the strains or species of Plasmodium, the others being Plasmodium malariae, Plasmodium vivax, and Plasmodium ovale. So we have Plasmodium falciparum taking responsibility of about 95% of the deaths that are associated with Plasmodium infection. I know we commonly know it, in layman we commonly call it just malaria, but we do have a specific species that is called now Plasmodium malariae, which is not very common in our area or in our country, but it is there. Plasmodium falciparum is the most deadliest. It causes the most severe symptoms of malaria, or the disease that people call malaria. But it is actually very common in Africa, in sub-Saharan Africa, and in our country here in Kenya, we find it mostly in the Lake Victoria region as well as the coastal region. That's where it's stable. It's known to be there anytime, especially because those are areas that are humid and they receive a lot of rainfall, so breeding of the mosquitoes thrives very well. Then other areas that are also not endemic but seasonal are the western regions. So those are areas that you will find sometimes an epidemic of the malaria disease. And then we also are seeing now the low endemic areas, which is the central part of Kenya as well as Nairobi. So if we speak about the deadliest form of the malaria parasite, which is Plasmodium falciparum, we have it in our country, and that's why it's become a focal point for donor funding, just to make sure that it's kept under check, because it's been considered as the most, and even this is globally, especially in Africa. Let me say Africa, I won't speak for the rest of the world. We have a lot of cases of fatal cases of as a result of malaria infection, and that is Plasmodium falciparum. So yes, we have the fatal form. We have the form that can result to fatal disease. Yeah.
Okay. So how is malaria diagnosed?
Diagnosis of malaria is very simple, but it requires good expertise. It requires competent staff and the equipment. So the simple test that we are able to apply when it comes to diagnosis of malaria is just by checking the blood of the patient who has presented with the symptoms. And it can be a prick or it can be blood drawn from the vein. So different approaches depending on so many conditions. Like there are those who do the diagnosis in the field, so they will use the prick and prepare a smear which is stained, and that's the gold standard. The microscopy is the gold standard because you actually see the parasites under the microscope and you're able to quantify. You're able to tell what is the load of the parasite in the person who is infected. Is it in terms of percentage? And that also is very important for the doctors to be able to know what amount of treatment they'll apply for this patient. So it comes with quite some good expertise because we have had misdiagnosis in the past, and people have either been misdiagnosed with malaria, others have missed to see the malaria, and we've lost patients that way. So it's very, very important. So that's the blood slide. We also have other tests like the antigen test. That's a rapid test which is able to tell through a combination of the enzyme that is found in the parasite. It's called histidine-rich enzyme, which is a combination of that being the antigens and the antibodies in the cassette or the rapid testing kit, and you are going to see a reaction that tells you if this person has malaria, but that is not a very reliable method because you have to confirm under the microscope. Other superior methods are also there. We have the antibody testing, and sometimes these ones are they are very useful, especially if you are trying to diagnose malaria that has moved from just the circulation to other parts of the body. You've heard of cerebral malaria and the likes. So we have the polymerase chain reaction. Those are superior tests, but again, they are also not easily affordable to just anyone. The PCR test for malaria is common in the developed countries because there, I think, also they introduced it in the earlier days, and like I said again, it's an expensive test. Then we have the antibody test, which comes as a result of the body's immune reaction to the infection. So here in Kenya, we apply majorly the slide, blood slide, where you go, you get that prick, a smear is prepared, and the examination is done under the microscope, and that's where you rule out malaria infection.
So I can say that's the most effective.
Yes, actually it's considered as the gold standard according to the WHO guidelines.
This is how a positive one looks.
So
you see a line on the control as well as the test.
Treatment for malaria, that's done mainly by the clinicians who are managing the patients. The most commonly recommended is chloroquine. Good old chloroquine has been used for many years, but as time has evolved, the parasite has also evolved, and in the effort to try and develop resistance to some of these drugs, of course, we are finding a pattern where people are not responding. Not all the infections are responding to chloroquine. So that's why they're bringing in the ACT drugs. It's a combination of drugs that have now come in. They are superior, and they have now come in to be able to eliminate that form of malaria parasite which is resistant to the chloroquine. Yes. Okay. The thing is, cerebral malaria. Is caused by Plasmodium falciparum is one of the parasites that are highly associated with cerebral malaria, where you'll find the parasite has crossed what we call the blood-brain barrier and has gone to the brain cells. It can cause swelling of the brain. It can cause convulsions and all those things that are associated with what happens when the brain cells are affected. You sleep, you're confused, you have the convulsions. So that severe form comes as a result of delayed treatment, delayed diagnosis, and it definitely can be fatal. You know, anything that goes to the brain is very sensitive, so it really can result to severe malaria disease and death.
Okay, you told us earlier where the malaria is more prevalent. So what about the new species of malaria that is said to be more prevalent in urban settings?
Okay, so when it comes to the malaria that we are seeing in other areas aside from the known endemic areas, because like I mentioned, we have areas that everybody knows. If you go to the Lake Victoria, you need to take prophylaxis. If you're going to coast, you need to take prophylaxis. So everybody knows there are certain areas that when you go, chances are if you did get prophylaxis, you might catch the infection. Now, there are certain trends and patterns that are being observed in certain areas that we didn't see malaria in the past, and this is coming as a result of climate change. Even areas where we would say are not warm and humid, when you start seeing temperatures rising and occasional sudden rainfall and things that were not being experienced in certain areas in terms of climate, then you start finding a pattern of the female Anopheles mosquito breeding in those areas. So what we are seeing mostly is a change in pattern, where in areas where a clinician will not request for malaria, now they say let's just see could it be malaria, even when we know that these are areas that we never used to find malaria in the history of malaria infection and disease. But the other thing, we have this species, the Plasmodium knowlesi, which is more of it's not just human, it's like a zoonotic. It causes zoonotic infections. Zoonotic infections are those ones that are found both in human and animals. Yeah, but the main four strains among the very many strains of Plasmodium are Plasmodium falciparum, Malariae, Vivax, and Ovale. Yeah.
Okay.
What I can say is, as a country, I think the Ministry of Health, in collaboration with partners such as CDC, AMREF, other global funds that come in, it's really been it's made a lot of difference, and also the expertise that is coming in through the private sector like ourselves, being able to give proper diagnosis and in good time, it has really saved in terms of what we were noticing in previous years as far as fatalities due to malaria infection are concerned. And I think it would be good to just continue with these trainings from people who are leaving university and get everybody on board as far as accurate diagnosis and also treatment of the disease. And this will be very, very useful to the people of Kenya.
Oh, okay.
Yes.
So,
thanks to the interventions that are coming through the WHO, we have vaccines, some that are already in use and others are under studies. So some of the vaccines that are being applied right now, I know there's a vaccine that is being used for children below 5 years, which has really helped, and it has also proved to be efficient. And we also have another one that is still it's not been released for use, but it is under clinical trials, and that one is actually more promising because they're looking at 75% efficacy which is what the target for WHO is as far as vaccination is concerned. But again, these vaccines, I think after every 2 years, you're supposed to go back and get the vaccine. And this is very, very useful, especially in those areas that are endemic for malaria, because when we get the epidemic or the outbreak, like when it rains and then the mosquitoes, the breeding of mosquitoes multiplies, then the infections also multiply, and we can find tenfold of what we find in normal times, which means that the infection rate is very, very high. Yes.
So you would like to confirm the names of the vaccines?
Yeah, definitely. I have written them and I will
Tell us about the vaccine.
There's a vaccine that has been approved for use since April 2022. We have children who have been vaccinated against malaria, and this vaccine is known as RTS or Mosquirix. So it was rolled out in 2022, April. And since then, we have several children who've been vaccinated, and that's especially in the endemic areas, those that I mentioned earlier. Then we also have the R21, which is also a vaccine that is undergoing clinical trials from the WHO studies that are being conducted in 4 countries, Kenya, Tanzania, Mali, and Burkina Faso. And this one looks like once the data is submitted for approval and the clinical trials are concluded, they say that this one could have efficacy up to 75%, which is very good, because that would confer protection to the individuals who are vaccinated, at least at a good percentage. And this one, once it's rolled out, then we can say that we are at a safe place as a country.
Oh,
Yes.
okay.
Yeah.
So that is oil.
Yeah.
Maoni ya mwisho yenye umeacha?
Sasa maoni ya mwisho si labda
Umemaliza?
nilikuwa nishasema maoni ya mwisho, labda sasa niwaambie wakuja hapa for testing. Yes.
Yes.
So
We are open 24 hours.
yeah. So medical diagnostics is one very important arm when it comes to patient management. And here at Real Lab Diagnostic Lab, we are located at Professor Nelson Awori ground floor. We have the expertise and the experience and the equipment. So we have what it takes to make the right diagnosis and give results within a reasonable turnaround time, and a reasonable turnaround time and accurate results for the patient to be managed well and in a timely manner before we get disease progressing to fatal stages. Yes.
Okay.
Yeah.
Thank you.
Can still edit that one.